Hi, this is Shannon, and this video is for studying for our assessment for our final practicum, heart and peripheral vascular system. I'm going to start by introducing myself to my patient. Hi, I'm Shannon. Could you tell me your name, Mr. Sunshine, and your date of birth? Great. And so do you understand what we're doing today? Right, we're doing a heart and peripheral vascular system assessment. It is kind of extensive. I'll explain to you everything that we have going on as we go. I do need to wash my hands, and while I wash my hands, if you could disrobe from the waist up. So just remove your shirt for me, and then I'll wash my hands, and then we'll go ahead and get started with the assessment. Perfect. Okay, so now that I'm done washing my hands, I'm going to start with just looking at your overall, your skin color is normal for ethnicity on your arms and on your legs. I don't see that you're absent of hair on your legs. It looks like you have hair growth. Your skin is warm to touch. The texture is good. You have good skin turgor, no tenting noted. Turgor is less than 3 seconds. I'm going to assess each one of your fingernails, and those look good. They're clean and trimmed. No clubbing visible. Your nail beds are pink, and your capillary refill is brisk, less than 3 seconds. Okay, so all of that looks really good, and I'm also going to go ahead and look at your toenails. I'm going to put on some gloves, assess the cap refills in your toenails as well, and those are all brisk as well, less than 3 seconds. Okay, great. Okay, so let me go ahead and remove my gloves and wash my hands again, and then we're going to go ahead and I'm going to look at your pulses. So I'm going to start up here at your neck and look at your carotid pulse. I don't see any bulging noted. I'm going to have you turn your head to your left. Okay, and I'm looking at the carotid on your right. It all looks good. And then I'm going to go ahead and touch that on both sides. It looks like 2+. You have a really strong palpable excuse me, pulse. That's perfect, totally normal. Okay, and then I'm going to go ahead and listen with my stethoscope and assess your carotid. Okay, and then if you could just hold your breath so I don't hear breath sounds here. And then breathe on the other side as well. Perfect, listening with the bell. And I don't hear any swishing or bruise noted. Completely normal, sounds like your carotids are healthy. Okay, so next we're gonna go to your pulses. We're gonna look at the one at your wrist, which is your radial pulse. And we'll look at both of them. And the pulse on your right is a 2+ regular. And then the one on your left, that pulse is also a 2+. So equal pulses. That's really a great finding. And then I'm going to move up by your elbow on the inside of your arm, and I'm going to look at the brachial pulse. And on your right and on your left simultaneously. And that's a 2+, and that's regular as well. Okay, and then we're going to go ahead and I'm going to move down to the insides of your ankle. And I'm going to assess your posterior tibial pulses at the same time. And those are 2+ bilaterally as well. And then I'm going to just move down to your feet. Perfect. And I do see that those are 2+ as well bilaterally. So I'm going to go ahead and wash my hands again. And then I'm going to have you lay down while I wash my hands. And then we'll go ahead and proceed with the rest of the exam. Okay, so I'm first going to look at your skin on your chest and your abdomen, and that your skin is intact. I'm going to look with a light. I don't see any pulsations, heaves, or lifts. Your chest looks normal, symmetrical. I see no evidence of an enlarged heart. Okay. And then I'm going to go ahead and palpate on your chest for any kind of tenderness. And if anything is painful for you, just please let me know. I'm going to have you put your hands over your heart. Okay. No tenderness or thrills noted. And then I'm going to go ahead and find your apical pulse. So go ahead and put your hands back down to the side. Perfect. I feel your apical pulse. And that is present. Okay. Okay, so next we're going to go ahead and auscultate. So I'm going to listen with my stethoscope. And I'm going to start up here listening to your valve. So I'm going to do that first with the diaphragm and then with the bell portion of my stethoscope. So we'll start up here at the aortic, that first valve. And I'm finding that in the right second intercostal space on the right sternal border. And I do hear an S1, and the S2 is louder than the S1. Okay, perfect. I'm going to go ahead and move over to your pulmonic valve. And that's just straight over from the aortic. So I'm going to listen to the left side of your chest at the second intercostal space. And I hear an S1 and an S2 as well. The S2 is slightly louder. So I'm going to go ahead and move down from the pulmonic to the tricuspid. At the left intercostal space and the tricuspid, I hear the S1 and the S2 as well. The S1 is louder. And then I'm going to go ahead and go to the mitral. And at the mitral, I may be able to hear the S1 and the S2 as well. The S1 is louder. Okay, so I'm going to go back through that same pattern, and I'm going to listen to the heart with the different side of the stethoscope. So I'll be listening with the bell. And I'll start at the aortic. And then I'm going to move over to the pulmonic. And I do not hear any murmurs noted, nothing abnormal, no S3 or S4 noted. And down to the tricuspid and the mitral. And no S3 or S4 noted there as well. So completely normal findings with your heart. And so that is going to conclude it. I'll help you sit up. Perfect. And then you can go ahead and put your shirt back on. And I found today that you had a completely normal exam of your heart and peripheral vascular system. Your skin color was good, normal for ethnicity, no lesions, temperature warm to touch. Your turgor was good, there was no tenting, you're well hydrated. Your fingernails and toenails had great capillary refills. No signs of a fungus, no clubbing. You had really good capillary refills on both your toenails and your fingernails. Your carotid was strong and palpable at 2+. Your radial pulse, brachial pulse, your posterior tibial, and your dorsalis pedis pulse were all 2+ regular pulses bilaterally. And then your heart was in excellent condition. I did not hear any murmurs, and I was able to assess S1 and S2 in all of your valve areas, and again, did not hear any murmurs. So everything looked great today, and if you don't have any questions, I'll go ahead and excuse myself and you can go ahead and get dressed.